My name is Peter McGuire. I'm from Shasbury, Vermont, and I had a transformational interbody fusion done on L4 and L5 by Dr. Robbins. I've had low back pain pretty much my entire life. I started getting pains in my hip. Then I would get a pain in my knee. The two pains would connect, and my whole left side of my leg would be in such pain that I'd have to sit down or do something to get off of it. So I went down to Albany, talked to him, started asking a lot of questions because I was concerned, you're going in the base of my spine and there's all kinds of things that could happen. What could happen to me if things didn't go well. And he assured me, everything's going to be fine, it's not a big deal. So I asked more and more questions. He said, "You're not ready for this procedure." I said, "Yeah, I am. I'm ready to do this. I just am curious what you're going to be doing in there. You're cutting into my spine and moving bones around and drilling and putting screws in." And he said, "No, you need to get a second opinion." I said, "Okay." So I went over to Dr. Robbins, made an appointment, and sat down with Dr. Robbins, and we discussed my situation, the problems that I was having and the nerve pain that I was having. And I was very impressed with Dr. Robbins. We sat down for probably an hour and a half just discussing my situation, what he was going to do, things he had done in the past, the full procedure that he was going to do to me. And what I liked about his approach was that he was really concerned about making sure that the spinal column, the spacing was rebuilt, and then I would have the proper spacing between my two vertebrae when we were done. I went home and I researched the procedure. I researched Dr. Robbins, did some, found his name on the internet and found out that he was very well respected and well known in Vermont. I was very happy to come back to Bennington and have it done. I think he did a wonderful job. The hospital, all the care I had at the hospital was great. Obviously it was nice to be able to have my family and my wife and come over to see me and not have to travel to do that. When I woke up from the surgery, there was no nerve pain in my leg, my hip and my knee. All of that disappeared after the surgery. I don't have the pain. I'm not restricted to any of the activities that I did before going into the procedure. I had pretty much given up on golf. I couldn't ski, could not walk, go for a walk. Jogging was out of the question. Now I can pretty much do whatever I want to do. I would absolutely refer him to anyone who needed to have something similar done. Matter of fact, I did talk to a friend of mine who's thinking about having some surgery done, and told them that they should think about Dr. Robbins if they have the procedure done.